We've seen that a virus, a pandemic, COVID, has affected the whole world. But actually, what we've also seen, that people with chronic diseases like diabetes have been, in many countries, most severely affected by the virus, by the coronavirus. So actually, people with diabetes and other NCDs seem to have, or actually you can see from the data, have been more severely affected to disease and serious hospitalization. So what does that tell us? Well, it tells us that you cannot just distinguish infectious and chronic as something separate. It has to be seen as an integrated need for care, so that health systems must be ready to address chronic diseases and infections alike, or jointly, or in a coherent health system way. I think we knew that before Corona, but I think Corona has, or COVID-19 has made it crystal clear to all, to us, to QAM, to World Health Organization, to every country in the world, that there's only one way of building a strong, resilient health system which can address any health burden that will come or is already here, and that's the integrated health system. And I think with the partnership with QAM and WDF and QAM's long-term, decade-long presence in many countries with the ministries of health, we can be part of that movement to show the way that the way forward is such integrated way. Our partnership with QAM, Doctors with Africa, is one of the most important partnerships worldwide of WDF, World Diabetes Foundation. World Diabetes Foundation needs strong partnerships to be sure that our support and our investment to countries are effective and produce useful results for the countries and for the patients with diabetes in the countries. So we need strong partners who have the experience, who have the resources, and also very much know how to collaborate with ministries of health, health authorities, clinicians, hospitals, in sometimes very challenging circumstances. Like in Mozambique, we had the Idai flood, in Ethiopia, where we sometimes have humanitarian emergencies, and of course also Sierra Leone, where there are also often challenging circumstances to implement the projects that we support with QAM. So I think without QAM, WDF would not be able to invest with the results we seek. So we are very grateful to QAM for the trust they have shown us and for the creativity and commitment they have shown to the partnership with WDF for almost 10 years. So that today I am here for the second time in Padova visiting QAM's headquarters, and we are able to discuss not only the past and the present, but also the future, how QAM and WDF and the countries we work with, the ministries of health, the national partners, civil society, and global partners as well, can come together to address the burden of diabetes, other NCDs, and working together now towards universal health coverage, which is the goal of all countries by 2030.